Hello, good morning, ladies and gentlemen. I'm Orji Ikechukwu Anthony. I'm here to present the research titled Review of Prevention of Mother Transmission, PMTCT, program in a primary health center in Abuja, Nigeria. 90% of global pediatric HIV patients are found in sub-Saharan Africa. And Nigeria currently harbors the second highest global HIV burden. General population prevalence of 3.4% and ANC prevalence of 3.0%. And nearly all pediatric HIV infections can be prevented through an effective PMTCT program that provides a highly effective ART and pediatric interventions. So the above statistics underscores the to have a strong PMTCT program so that we can achieve zero new infection in Nigeria. And we know that strengthening HIV care, especially at our primary health care level, is vital to reversal HIV, which is the ingredient to ending AIDS epidemic even in Nigeria and the world at large. Therefore, the review of this PMTCT program in primary health center here in Abuja cannot be better than now. So what is the problem? AIDS epidemic cannot end without ending new pediatric AIDS infection. And that is one of the United Nations strategies of 3 zeros. To end the new pediatric AIDS infection, a robust and thorough PMTCT program must be put in place. And this requires screening all pregnant women ANC and giving ART for all positive mothers and ARV prophylaxis for all babies born to positive mothers. And we looked at certain questions and we want to ask, what is actually the prevalence of HIV among pregnant women who attended ANC at this health center in 2015? And what is the percentage of positive pregnant women who were placed on ART at the health center in 2015 according to the national guideline? And what is the percentage of babies born to HIV positive mothers who were given ART at this health center according to the guideline? And our methods we looked at is a retrospective cohort study, the existing data for all pregnant women who attended ANC at this health center during the study review year, which is January to December 2015. And we got our data extracted from the PMTCT, ART, and clinical registers, as well as delivery case notes of all the seropositive clients. The data extracted was analyzed by univariate and make tables, and which we presented with bar chart and pie chart. And the results reveal that 1,418 pregnant were registered for ANC at the Kagini Health from January 1st to December 31st, 2015. And all these clients were screened for HIV antibodies in accordance with the guideline. And also found that the seropositive prevalence for HIV among pregnant women attended ANC at this health center was 2.8% in 2015. The study also that 70% of these seropositive pregnant patients received ARV therapy at this health center. The remaining 25% were lost to follow-up. We also found that 3% of the babies born to the seropositive mothers received ARV at this health center. 66% were lost to follow-up. And in this one, we found that it's a good practice at this center to test all the clients who came for antenatal clinic. And this is in line with the national guideline, and this facilitates diagnosis of new infections, as was the case in this center, where 85% of all the diagnosed cases were, and 80% of all the cases treated were actually newly diagnosed cases. And in further discussion, the seroprevalence of 2.8% as we can see in the figure 1, which is at the end of the slides, is similar to the national seroprevalence, which was state 3.0%. And coming to the seropositive mothers who receive ARV, as we said, 5%, and this we are 25 was just to follow up. We found that this is not a good practice, and it portends danger to the process of eliminating mother-to-child transmission. Because those patients who drop out after the HIV positive were diagnosed never received any follow-up. So we do not know if this was treatment elsewhere or not. And this is an identified gap which we addressed to strengthen the PMTCT program in this center. We also found that there is a poor performance indicator in respect of injecting ARV for the babies born to these seropositive mothers. An abysmally low percentage, 33% only were initiated. This is very poor. It cannot help us to achieve a zero new transmission. So this is also a challenge of follow-up, as we saw in the previous situation. These are the references, some of the references we used. And in conclusion, we'll say that the study has revealed that the 2015 ANC seroprevalence for HIV is 2.8%, which is actually similar to the 15 national ANC seroprevalence of 3.0%. And concerning ARV therapy initiation for seropositive mothers, we are saying that 0% of them were on ARV therapy, which falls short of the expected. Furthermore, for babies born to positive mothers, only 30% were placed on ARV therapy, yet 100% expected. So these figures are below the performance expected of this kind of approach, and it presents great danger to the goal of eliminating mother-to-child transmission. So we recommend the following: that there should be training by the relevant authorities like the health authority in charge of this center and the partners who are running this program, to retrain the HIV counselors, to position them for a robust post-test, pre-initiation, and adherence services. This will help to retain the patients when they are diagnosed. And then we also find that treatment support specialists should be deployed in this center for adequate follow-up of these clients. And this will help to reduce the incidence of dropout. And future research, we are saying that an evaluation of the prevalence of HIV-negative children at 18 months of age in this center will be very, very important. To actually evaluate if this PMTCT program is actually working or not. And we can also look into the factors that affect dropout rates in this PMTCT program, so that we can retain patients and give them the required treatment. So these are the figures which shows figure 1 and figure 2 about the rates of initiation of clients. And this is the figure 3, and this is the figure 4. And we are saying thank you very, very much for listening.